Hey everyone, it's Dr. David here. What's up? How's everybody doing? Just move my phone to do not disturb so I can just focus on you guys. We're going to be talking about sciatica here today. Let me just get Instagram going as well. Let's get going live there. Fantastic. All right. So top 10 sciatica treatments to avoid surgery and heal for the long term. That's what we're going to be covering here today on our live stream. We're live on YouTube, on Instagram, and on Facebook. I have this software here where I can see our comments from Instagram and from, I'm sorry, not from Instagram. I can see them from Facebook and YouTube, but I can't see you if you're on Instagram. I'm so sorry. So hop on over to YouTube or Facebook, and if you want to drop a comment in, I can see it. I'll be getting to some comments by the end of the talk here today. I'm going to go over my points first, and then we will discuss. But before I go any further, can you guys just give me a mic check? Are you guys able to hear me? Oh, Kimberly, look at Kimberly. You're ahead of me, Kimberly. Fantastic. Thank you. I appreciate you. I appreciate you hearing me, Kimberly, and letting me know. Kimberly is always here, ready to go, ready to help. Oh, and I just want to highlight this. The Elder Skatesman, I love that name, just became a YouTube member while here on the call. Fantastic. Thank you for joining our YouTube channel membership. Thank you. Oh, it looks like we have an outage on Facebook. Just checking that in. It says we're connected, but I got a notification saying that there's an outage. Sorry, Facebookers. Jump over to YouTube. All right, let's get going on this list. So sciatica, what is it and how does it affect you? Let me just give you a brief explanation for what's going on with sciatica. Got my skeleton here. And let's see if you can see these nerves here. I'm going to pick it up a little bit. I know your controls on your screen might be affecting how you can see this. I want to move it closer anyway. So here's your tailbone. Here's your low back. I call this the pelvis bones, these big wing-shaped bones out here. And then you have all these yellow things that are sticking out in this area. Let me turn it around to the front so you can see what this looks like. You have these nerves here in your low back. These nerves, they come out the sides. They're called peripheral nerves, and they all bunch together up here on the front side, these right here. And then these bunch together differently on the tailbone area. But they all kind of converge to make the sciatic nerve. And that sciatic nerve pops out. You have two, but it pops out right here on this edge. You see this edge of the bone that's kind of curved? We call that the sciatic notch in anatomy. And just to make matters worse, there's a ligament that closes the gap right here to make a full-on hole, a circle. And so if you get any sort of problems in this area, you're going to pinch your sciatic nerve. And one of the most common things that we see here that causes sciatica is a pinched nerve up here in the low back because of like a herniated disc putting pressure on it. That's what that red thing is right there. It doesn't always happen there. It can happen in different spots. And then that nerve goes down from the low back and it goes in through the pelvis and out the sciatic notch right here. And if you get a shift in your pelvis or some muscle problems in the area, you can also get this nerve pinched here. Then that nerve goes down the back of the hip. And if you have hip problems, you can get the nerve pinched there. That nerve keeps going down. I want to make sure not to hit the ceiling and cause a funny blooper for you guys here. It'd be funny for you, but not for me. That nerve runs down here into the back of the knee, and it goes all the way down into the foot, down the back of the leg, all the way to the tips of the toes. It changes names depending on where you're at, but that same nerve pathway is present all the way through. It's called the sciatic nerve. And so it's possible for you to get back pain, hip pain, butt pain. Butt pain is probably the most common. Pain in the back of the hamstring, like the back of the thigh, that's most common as well, along with butt pain. And then it can go down into your calf. People get cramping in their calf muscle from sciatica, and they don't always think that that's sciatica. And then even in the arch of your foot, people get cramping there too. That's one that people think they have plantar fasciitis. And that's a common misconception that plantar fasciitis is coming from the plantar fascia, pain at the heel, but there's a branch of the nerve that goes right over that insertion of the plantar fascia. And if your nerves are irritated from the sciatic problem, it could be that it's actually sciatica presenting as heel pain. And people think, even healthcare professionals get confused. They think that it's plantar fasciitis. I can't tell you how many people, I mean, I'll give you the rate. 9 out of 10 plantar fasciitis diagnoses that I've seen, like patients coming in and they hand me their note from the doctor that says, they say I have plantar fasciitis. And I look at the note and I'm like, yeah, you wrote plantar fasciitis. Then I check out the patient and I'm like, you don't have plantar fasciitis. This is sciatica presenting as heel pain. And let's treat the sciatica. And we do, and it gets better in the foot. So just want to make that connection. That nerve runs all the way down into the foot. It can, and there's many different areas where you can get problems. So as a result of that, let's get into the list. Is anybody, I don't have any more comments coming through. Can y'all comment? Just tell me where you're from. Say hi, just to make sure we're connected here. So I'm not talking into the abyss. Anybody out on YouTube, just throw an emoji up on the comments or say, I'm from whatever state or country you're from. I'll keep going in the meantime. Oh, did a comment come through? No, no comments coming through. All right, I hope this is broadcasting. Oh, Cindy's here. Okay, Cindy Castillo says, hello from Dallas. Oh, fantastic. Great. Okay, they're coming in. You guys are with me. Fantastic. Jesus in, I can't pronounce that name, from Saskatchewan, Canada. Fantastic. Okay, Facebook's now working apparently. Ann Garcia says, hello from Dayton, Ohio. I think I recognize your name, Ann. And then Kimberly says, I feel like I'm in medical school with you. You've taught so many people, very much appreciated. You're welcome. I know my anatomy a little bit. I can keep up with all the big guys up there, no problem. Eggle says hi from Estonia. Anna says she's from Alaska. Fantastic. Manuel says Manny from Miami. Great. Thank you guys all for chiming in. Delinda says she's in Oklahoma. Hello from England, from Katerina. Lori says, I can hear you. Pam says, I'm here. Fantastic. Thank you guys all so much. Obi Okoye says, I am watching you from Nigeria. Awesome. Africa's here. Canada. Bana Robinson is from Canada. She says, hi to everybody. Cindy says, we're with you all. Thank you guys. I appreciate it. I need that feedback sometimes. Vi Lopez says, hello from California. John Russell's in New Jersey. Hey, John. Cindy Milan says, love you so much. This is Cindy from Milan, LA. Fantastic. I don't know if that's LA, Louisiana or Los Angeles. Both cool places. Hello from Switzerland. Liv Tout from Barbara. Fantastic. Regina is in Cali. Hey, Regina. All right. Oh, Eggle says he found a great mentor talking about the anatomy lesson. Fantastic. Oh, we got somebody from Egypt. There's some good places here. We got Northern Africa and Southern, and I'm sorry, I forgot where the other country was from, but we got Africa represented here. Diane's in Pennsylvania. Lisa in Ohio. All right, I'm going to take a break. There's many, many more comments coming through, letting everybody know. Thank you that I am heard all over the world right now to you guys. So let's get going on this list here. The number one thing that you need to start to do to fix sciatica, this is the most important one. You need to work on your abs. Most people that have sciatica have tremendous weakness in their abdominal muscles. And going back to the anatomy explanation here, well, I'm going to tell you why. Make sure I got a viewpoint here. We'll start here. Abs cover all this space at the bottom of the rib cage. They connect through some tendons to the spine on the back, and then they connect to the bottom part of the upper part of the pelvis on the bottom here. That's all abs right there. Because the abs stabilize everything in this area, that's their job, is to make sure that you're able to, that you have control over this middle part of the body as you do all the movements you do in life. Walking, moving around, picking things up, and your core, your abs are very involved in that process. And if you don't have good ab strength, your body finds a way to just do it, right? You still have to live your life. You still have to take care of people and work and do all the things. And so what happens is a compensation where these back muscles say, I got you, abs, no problem. And that's okay from time to time. But if that's the way that you move all the time, where your back muscles are just taking over for your abdominals, then you have the setup for your back muscles that are right here directly up against your spine. Those muscles will then add compression and start to pinch these nerves on the sides. The other thing that could happen that causes the sciatic pain that's related to the abs is because the abs attach to the rim of this bone here on the front as well. If you have weakness in your abdominals, then you lose stability in your pelvis. And that sets up the possibility for these bones to shift subtly. And if these bones shift subtly, well, guess what? There's a sciatic notch where the sciatic nerve passes. And if this bone rotates this way or this way, as it likes to do, the edge of the bone is going to come down and pinch your nerve. And it's because of ab strength. That's the root problem. Now, I do techniques to correct the alignment in the pelvis and all that. Obviously, I do that stuff in person. We do that here in the clinic. But that's just temporary relief because that bone's going to shift again if you don't have good ab strength. And you don't, I can make things a little bit quicker, but even if I never saw you in person to manually correct your pelvis alignment, as we call it here, you can correct it yourself by working on that ab strength because your muscles will pull the bones into the right spot. And as long as it's not too far gone, ab strength is critical for solving sciatica. You have to have good ab strength. After that, a close second is glute strength. And here's how this one works. When you have good ab strength, because the abs connect to where all those places I told you, glutes are right here on the back. They connect to the back of this pelvis bone, and the fibers go from all over the rim right here. They cross over that SI joint and attach to the backside of the tailbone. So they provide stability to the SI joint to provide stability for this whole bone so that sciatic nerve here doesn't get pinched. If you have good glute strength, then you're also adding stability to the entire pelvis. So now you're preventing problems in the low back and the vertebrae in the back and the pelvis, because that's where you're most likely to get pinching on the sciatic nerve directly. Those are the two most common spots. So glute strength is super important. After that, you need to have good toe strength. Sorry, I combined the word here. Just going to write toe, I'll put a hyphen, toe strength. Sorry about my handwriting. But let's just talk about that one there because doing a lot of lifting today on the skeletons. Good thing it's not too heavy. All right, there's your toes. When your toes are strong, they help to support your arch because there's tendons that run right here in the arch of the foot. And when you stand and you put weight to your foot, your arch wants to just collapse down. But if you have good toe strength, you have a supported arch. But if your arch collapses down, it's stuck, then you add tension to the nerves right here, the same nerves that come out up here that make the sciatic nerve. So you are on a smaller scale tensioning, you're stretching the nerve at the foot by having fallen arches. If that's you, some of you guys know you stand on your foot, you look at it barefoot, or you look at your foot in a sock, and your arch is nice like this, and then it goes, it falls down. That's usually a toe strength problem. When you get better toe strength, then your arch is going to be able to be supported better, and that puts the normal tensions through your nerves, what they're designed to take. But if you don't have good toe strength, then you start to tension those nerves, and if you're walking around like that, if that's how you live life, then you start to slowly aggravate the nerve at the heel. I present as plantar fasciitis, but really it's nerve pain in the plantar nerves. But it can start to go up the leg into the back, into the hip, into the back of the thigh, and cause you some pain that's more sciatica-like in the buttock area and in the thigh. So watch out with that foot strength. That's a sneaky one, the toes. All right. Who else is here? We got Lisa from Ohio. Kathleen's here from Michigan. We got Audrey from Canada. Lots of Canadians in the house today. Fantastic. We got Marianne, who's in Georgetown, ZDE. Oof, I'm not sure what ZDE means. Maybe it's a typo. Seattle's in the house. Jennifer Lee, fantastic. I got a trip to Seattle later this month. We have Lori in British Columbia. Fantastic. Got a few more here. Joy, I love that name. Joy from Nebraska. We have Emily from Philly. Donna's in San Antonio. Oh, I love it. You're in my neck of the woods in Texas. Amy in India. We have India here. That's so cool. Eddie is in Oklahoma. We got one more here. Edna's in Ontario, Canada. Look at that. Lots of Canadians in the house. Thank you, guys. Hey, start dropping your questions in about sciatica because I'm going to get to them here in a moment. Let me go over the next part of the list here for you. All right. The next thing that you want to do is quit strengthening your back muscles. So this means stop or quit back exercises. This one, I think I'm kind of controversial with people on because it's so highly recommended by medical professionals out there, by the health profession as a whole. Is if you have a back related problem, you should be strengthening your back. That's kind of the mantra, the dogma that everybody gets taught in school, and it's partially guided by research, partially by tradition and history, and this is what we've always done kind of thing. But I've just never been good at following traditions, especially in the medical field, because there's so many just inconsistencies that I see as I'm working with patients and test things out. But here's the thing: when you strengthen your back muscles by doing exercises that make the back muscles right here on the back of the spine work, you're feeding the muscle imbalance that adds more compression to here, which is going to squash your disc. It just squashes everything. That's why we need to strengthen the abdominals on the front instead. That's the number one exercise I'm telling you to do. But you got to stop also strengthening the back. And you hear healthcare professionals, I get into it with them all the time. We'll get in passionate debates about this stuff where we have to say, well, they'll say, just strengthen everything. Do the back and the abs. And I tell them, no, because you're in an imbalance. Your abs are already very weak. That's why you have back problems, sciatica issues. So abs are weak. Back muscles have been dominating. They've been compensating for those weak abs. So if you start strengthening just your back muscles, then you're just going to put yourself in a further imbalance. If you strengthen everything, then you're just going to do this. You're going to get stronger overall, but still be in an imbalance, ultimately adding more compression to your back because your back muscles are stronger. What needs to happen is stop working on your back muscles and just get those abs up so that now you're in a balance. Once you're in balance, then it might be okay for you to do some back exercises and get stronger overall. But usually it takes people a better part of a year to climb their ab strength up to the point where they're in the right balance. It's going to take you some time. So I wouldn't spend time right now, if you're dealing with sciatica, worrying about trying to strengthen your back muscles. And it's tough because you might have been told by a healthcare professional to strengthen your back muscles. My advice to you, let me just paint the picture for you. You might, if you have pain right away doing back exercises, that is a clear sign of your body telling you, this isn't good for me. I hurt when you make me work my back, because it's the part that's causing the problem. It's feeding into the sciatica issue. It's part of the root cause. It's the muscle imbalance. So that's a clear sign that you should probably not be doing this. And you probably need to tell your healthcare professional, doesn't feel good to do that. Can I do something else? The other experience people have is they'll work on their back muscles. They'll do bird dogs. That's the one where you're on all fours and you're picking up one arm and then the opposite leg. And then you alternate other arm, other leg, or you're doing some sort of back extension, Superman type exercise. Those are the ones that I'm talking about. You might actually feel good doing them at first, like for a week or two, and then the pain starts to increase later. The reason I think that people feel good for the beginning part is usually because they haven't done anything. They've been relatively sedentary, inactive, and so any movement kind of feels good. But then you start getting the bad muscle stronger, the muscle that's been compensating even stronger, and you do start to eventually feel pain because now you're feeding into the muscle imbalance. I think that's how that works. So I don't know, is that your story? Leave a comment if that's something you felt. Let's go into the next one here. We got quit doing hamstring strengthening. So stop hamstring exercises. Here's why with the hamstrings. The anatomy lesson continues here. Hamstrings attach from this bone right here. This is your sit bone where you sit down. As long as you're sitting, on upright, because you could sit on your tailbone if you're slouching a lot. But if you're not slouching, you're going to be on this bone. That's actually where the hamstrings attach, kind of in this area right here. And you have 3 muscles that make up the hamstrings. They all kind of spread out from there A couple of them go one way. I think 2 come on the inside. Oh, that's an anatomy lesson that I forgot. I'll have to review that. But you have some that come on the inside, some that come on the outside. And they kind of split out this way. When you strengthen your hamstrings a lot, in the middle of your hamstrings, right between them, that's where the sciatic nerve passes. So if you're very active with your hamstring, if you get it to get stronger, you're actually compressing your sciatic nerve with more hamstring strength. And here's the thing, hamstrings also like to take over for weak glutes. They're compensatory muscles. They like to compensate for weak glutes. And what was number 2 on my list here? Strengthen your abs, number 1. Number 2, close number 2, strengthen your glutes. If you spend time strengthening your hamstrings instead, then these strong hamstrings are not going to allow your glutes to do their job. And you're going to be feeding into your sciatica problem. Stop strengthening your hamstrings. Not worth it. It's the same analogy that I told you. If these are your glutes, these are your hamstrings, don't work them both out because you're just going to do this. Don't work out just the hamstring because your hamstrings are going to go up. Glutes don't get enough work. Focus completely on glutes until usually about a year, 8 to 12 months. Then you'll have enough strength to start marching them both up together if you want to keep strengthening. Usually by that point, people are like, I feel fantastic. I'm walking, I'm doing everything I love. I don't really need to do a whole lot more strengthening than the current strength that I have. All right, who's talking to us here? Cindy Castillo says, been taking your advice and started working on abs a few weeks ago. Awesome. Let us know if it's helping you out. Jesus says, I appreciate you explaining so much instead of just saying do this. Thank you, Jesus. I appreciate it. I get the opposite comment of people saying, just tell me what to do. Stop explaining. You talk too much. And, I'll talk till I'm blue in the face. I don't care because I think the why is so important, right? It's just, there's tons of other content creators out there. And I've got some videos too, where I just say, do these exercises. I tend to explain, but I think the why is really important because you need to know what purposes is serving and when is it right? Because it might not be a right thing for you to do this exercise at this time. That's a really important thing. And understanding some details behind it will help you isolate when you should be doing things. Good catch there, Jesus. Marianne says, I just found you. Thank you. Georgetown, Delaware, Denmark. Amy says, how? ? And then we start getting some questions here. Jesus, how do you know how you've gotten? How do you know you are too far gone? Okay, we'll get into that here in a minute. Good questions coming in. Let's get to the next point here, number 6. Quit stretching. Some of you guys are probably really relieved to hear this, and others probably get really angry. The ones that are stiff, like me, I'm just a stiffer build in my joints. I don't like stretching. It doesn't feel great. The people that are more flexible, they tend to love stretching because it feels good for them and they're flexible. At the end of the day, if we're trying to just avoid having sciatica issues, you got to do what helps, right? Even if it's not something that you like to do. That's what I would hope everybody would want to do. But here's why stretching is a problem. The most common stretches done in people that have sciatica are going to be hamstring style stretches, hamstring focused stretches. So remember I told you the hamstrings run from here to here, and the sciatic nerve pops out of that sciatic notch right here, and then it runs downwards right between the hamstrings, and it keeps going past the knee, past the hamstrings. Well, if you're doing a touch your toes type of stretch, like where you're bending forward and touching your toes, or if you're sitting down and you're reaching your toes this way, anything where your knee is straight and your head is moving towards your feet, you're actually adding more tension to your entire nervous system. And the sciatic nerve is the biggest nerve that leaves your spine. And you don't want to aggravate that nerve by adding more tension. And let me tell you a little bit more about that. If you look at the skeleton from this view, right? There's the side view. Here's the front. Here's the back. Relatively speaking, where is the spinal cord? It's on the back, right? You don't have a spinal cord on the front. Spine is right here on the back, and that means your spinal cord, the part that is in the middle where the big nerves run, is on the back side of your body. And then the sciatic nerve pops out the back side of your body, on the butt side of the body. And then it runs down the back of your thigh. So everything's kind of on the back. So when you bend over forward or towards your toes, you're adding tension to your nervous system as a whole, especially the sciatic nerve. And if you already have an aggravated sciatic nerve, you're going to aggravate it even more by stretching. And it's confusing, I do have to admit, because your hamstrings might feel very tight. And it kind of does feel good in moments to stretch it. It's really it's two things happening at the same time. Yeah, your hamstrings are probably tight because they've been overworking. They were compensating for weakness in your glutes, likely weakness in your abs. But you also feel tension from your sciatic nerve being irritated. So you're feeling both, and it's hard to distinguish which one is which. And there might be some times where you stretch, you reach towards your toes, and you feel, oh, it's kind of relieving, but oh, it hurts so good. You got to be very careful. I got some alternatives to do instead. My recommendation, though, to everybody coming into my office, and it's pretty successful, we have awesome success with sciatica, is to stop stretching. Stop stretching. There's other things you could do that are going to be more beneficial for you. Let's get into those things. Number one thing to get into, sorry, just making sure I don't miss my notes here, is going to be this one. Knees to chest stretch. So to be specific on the stretching, it's reaching to your toes, reaching toes. Because this is kind of a stretch still, but it's not as aggressive. And the way you would do this one is you'd be lying on your back. You could actually do it lying on your side too. And you're tucking your knees up towards your chest. I like that one though, because your knees are bent rather than straight. As soon as you straighten out your knees, you start adding that tension to the hamstring, and it doesn't feel as good. But if you keep your knees bent and you're doing like a knees to chest type of motion, it's much easier to do that. And it might be relieving on your back. So that would be the better stretch to do if you're going to do a stretch. All right, then I got this one here next. Number 8 is start moving. And let me explain. Let me say it the other way too. Is avoid rest. When I say start moving, I don't mean like go start doing a lot of exercise. What I mean is do relative movements that are relative rest. In other words, do things that you can do that don't hurt you more. That's the best way to put it. And what I mean by that is if you can get some movement in that isn't aggravating to your sciatica problem, then it's probably beneficial for you. In other words, it's moving your nerves in a way that is productive. It's helping you out rather than hurting you. And that's important because when you get movement in your body, I mean, think about it. Like, think about my hand right here. There's nerves that go to my fingertips that start up in my neck. These same nerves up here in the neck, they run under the collarbone here, and they go all around the arm and run all the way down the fingertips. And it's the same thing down in the legs, right? We talked about the sciatic nerve goes down, goes all the way to the toe tips. So whenever there's movement in my hand, the nerves that end at my fingertips have to slide in and out of the way that they live in my arm. And it can potentially be felt all the way up in the neck. So if you're doing an aggressive stretch, aggravating your toes, adding tension because you're reaching towards your toes, you're putting a lot of motion into the system, a lot of tension into the system. But if you're just moving in a way that isn't extreme as far as stretching, like you're just walking, you're just doing your normal daily life, you're getting some motion in, and that little bit of motion gets the nerve to move back and forth within the space that it lives, and that's a good thing for the nerves. It helps the flow of the fluid inside the nerve. There's axoplasmic fluid inside the entire nerve length, that needs to move. It has to have some circulation, and it is generated with nerve potentials, action potentials, the signals going through, but also your movement, your physical movement does it. So start moving. Do what you can. Do what doesn't hurt you. All right, next up on this, we have some cardio. You might find that certain cardio can help you out. And usually it's going to be something that's not impactful. Bicycle is the easiest one. My only caveat with that is that if you're going to do the bicycle, make sure you're using the right muscles to do the bicycle. But because the sciatic nerve goes into your legs, getting some gentle, decent range motion in your legs is beneficial. And even if you can sustain it for 10, 20, 30 minutes or more without sciatica getting worse, it might actually be very beneficial for you just to get things moving, to get the nerve to move, to get your muscles to activate. And ideally, if you can get your glutes to work right and your abs to be working throughout the whole process that you're doing some cardio, it could be beneficial for you. All right, next up. One more thing I want you to avoid. This one's kind of like I see people do it every now and then, and I don't know. I think that it makes sense to avoid it, but I still see people doing it, and I want so badly to like shake them and tell them, stop, you're messing yourself up. Stop rotational exercises. So exercises where you're twisting. The one that I see that's most commonly done is like they're doing a partial sit-up position, holding a ball or a weight, and then twisting. And I think the idea is they're trying to work out their abdominal muscles, but because you're doing so much twisting, you're also working out your back muscles. The back muscles have to control. Plus, if you have a disc problem, like a herniated disc that contributed to your sciatic nerve, discs in the spine are very strong structures that can take movement in many different directions. But the movement that they suck at doing the most is rotation. And if you look at the molecular structure of the fibers within the discs, the way that they're angled, they're terrible at taking rotation. So rotational exercises need to just not be part of your routine if you have sciatica, especially if it's a disc-related problem. And if you don't know if you have a disc-related problem, you haven't had an MRI, you're not sure, I would just avoid it anyway. There isn't a whole lot of carryover into normal everyday life to be practicing rotational movements. And that you do them inevitably, right? You reach over and you might twist a little bit, but that's just like a one time, a few times a day that you do that. To practice rotation movements and do, dozens of repetitions, especially loaded with weights at the gym or as part of your exercise routine, I wouldn't do it. You're going to make your disc herniation worse potentially because your discs are not designed to take rotation. They're designed to hold you still. In fact, if you think about the fiber direction of your abdominals, their job is to limit rotation. The way, like if I'm turning to my right this way, I feel my oblique pull me and try to stop me from going that direction. And same thing when I go this way. Abs are designed to give you stability and not force rotation. So no good to be doing it for exercise, in my opinion. All right. I got a couple more things to present to you here. Actually, I got 3 more things to present to you here. Let's get into it. Some bonuses. Number 11 that could help you is traction. If you have a disc problem, which is common with sciatica issues, traction might help. Traction could also be aggravating, so you got to be kind of careful with it. And what I'm talking about is like an inversion table, like where you guys have all seen them. They're tables. You have to buy them. They're special just for this purpose. You get onto it, you lock your feet in place, and then you usually have some handles that tip you upside down, and you're hanging upside down. And the idea is to use gravity to take pressure off your back. If you have a more disc herniation related sciatica, it's usually gold. It can feel tremendously better and might help you avoid taking pain medications. But if it's not just disc related, if it's more like your pelvis shifted because of your weak abs, it might not make that much of a difference. And in some cases, it might even make things worse. So my advice to you is very often you can buy these tables like at warehouse department stores. If they have a good return policy, you might take it home, try it, see if you can return it. Or maybe even Amazon might have returns. You have to check with those. If you have a doctor's office you can visit, they might have one, maybe a chiropractor's office. Try it out and see. Many of these medical offices have special traction tables where you're not hanging upside down, you're lying down, and the table is designed to move apart. It's got motors attached to it. You might have a harness to put on, and that's another version of traction, but those machines cost a lot more than the inversion tables. So you might see if they benefit you, to see if you might invest in one at home. But traction could be an option for you. All right, 2 more things here. Next, keep messing up with my board here. Weight loss might be something you need to pay attention to. Now, I'm popular with saying this. You don't always need to lose weight to fix these problems. Now, if you're too overweight, if you're obese, morbidly obese, then your sciatica might definitely be from a weight problem, and losing weight might be the priority for you, more so than doing all this other stuff. I mean, it doesn't mean you don't do this. It just means you need to really focus on this. If you have 10, 20, 30 pounds to lose, you probably don't need to worry about weight loss as much. But if you have 100 pounds, 150, 200 pounds to lose, you need to worry about weight loss first, because all that extra weight around your midsection, especially all that extra weight right here, is not letting your abs work right. And yeah, you can work on your ab strength, but if you have dozens of pounds of weight hanging from you right here, your abs can only do so much. It's going to take you a long time to overcome that, plus all the other side effects of being overweight. You got heart problems, blood problems, diabetes. There's so many other issues. It would be more important for you to work on your weight if you're significantly overweight. But mechanically speaking, if you have a lot of weight to lose, it's just putting your abs in a terrible position to function. And that extra weight right here just forces your body to want to lean back every time you stand up. And guess which muscles are going to be working more? Back muscles. You're just at a mechanical disadvantage if you have a lot of weight in the front. Now just think of pregnant women. You know, when women are in their final trimester of pregnancy, of course, that's for the reason of a baby. The baby's just right here in the front, and you see the women do the waddle. They're doing that because their center of gravity is off. But you see a similar walking pattern in people that are very overweight. They don't walk normal. They waddle. They walk different. It's because they're using their muscles inappropriately because of the weight. Their center of balance is off. Go lose the weight, guys, if you need to lose it. Like I want to be a voice to kind of, be mean dad here. You got to put the fork down. You got to start burning some calories, talk to the doctor, get on a medication if that's right for you. Figure that part out, because it's going to be more important for you than just weight loss and, diabetes. It's going to help your back. It's going to help your mobility. It's going to change your life if you lose that weight. All right, final one here. The massage gun used, I'm going to put an asterisk here, used carefully can make a big difference. And I've got a certain massage gun here off camera. Let me just grab it real quick, that I've been experimenting with that I love so much. This is a massage gun with the swan neck. And this one's really cool because you can get onto your back this way, just so that you can see how this one works. And we'll put a link in the description to this massage gun. By the way, the brand is Care King. I don't know if you can see that. Yeah, there it is, Care King. I'm not loyal to any specific brand. I tested different ones out that have the swan neck, and I like this one. You can detach that, detach the head. That's what I was showing you. It's a little stiff, but that's okay. And it's a normal looking massage gun this way, and it functions the same. It's got the little, you can work on your thighs here if you want. It's got good power. I tested some other ones I didn't like because the power was too low. Turn it off that way, and then you attach the swan neck. And check this out. So worth it. I think you need to get this if you have stiff back muscles. Turn it on there, and it works right there. Then you just turn the handle over, and you can get on your back and free up those stiff, tight muscles in your back. And this is beneficial because if your muscles are overworked, they're compensating. They're going to get stiff. They have an increased resting tension. They tend to rest stiff at rest, like you're sitting around and they're still kind of working. If you can massage them and let them free up, then when you go to do some ab exercises, they're not going to want to take over right away because you've lowered their action potential threshold. In other words, you've lowered their desire to want to activate when you go do something where you should be using your abs, and they'll start to take over. Plus, it feels good. You're just going to feel relief. You're going to feel looser afterwards. So I like this massage gun a lot. This doesn't bend much, by the way. It's kind of, it has some springiness to it, but you can't like adjust it. It's supposed to be this way so you can reach over to your back and use it on your back. All right, guys, that does it for my talk here. Let's get into some comments here and see what questions you guys have. Let me start at the top here. We have Audio Bump that sent us a couple of heart stickers with eyes on them. Marine says, how do you lessen my Baker's cyst, knee pain, and patellofemoral pain? Still in phase 2 because of this. Want to go to phase 3 because I can isolate my glutes, feet, and lower abs. Good. Thank you for your program. It's helped me tremendously. Okay, so I think Marine's in our patella pain program, patella pain recovery program. It's one of our online programs that we have for knee problems, which, by the way, I need to mention this before I answer the question here, Marine. We are in development right now for a back pain recovery program in which we have many tracks that are specific to back conditions. One of those is sciatica. We also are developing a track for lumbar stenosis, for disc herniations, degenerative disc disease, sacroiliac joint problems, spondylolisthesis, back spasms, and a couple other things. We are hoping to get this program out as soon as possible. I don't have a date just yet, but what we do have right now is an opportunity for you to sign up for a wait list. If you want, just go check out the description. If you're watching this live right now, it might not be available. It'll be available real soon. And we have a website where you can type in your email and we'll notify you when the programs are ready to go so that you can be one of the first to join our program and get our exclusive content that isn't anywhere else on the internet. It's not going to be on YouTube or Facebook or anywhere else. It's only for members of the program, plus a bunch of other stuff. You'll see on the page once you click through it, some of the things we'll be putting on there. All right, let's get to Marine's question here. So how do you lessen the Baker's cyst, knee pain? Keep going through the program. Keep going through fixing the muscle imbalance, Marine, getting the glutes to work, massage those quads. Not with this one, put it right here, normal looking massage gun. And that will decrease the pressure in the knee joint. Now, the Baker's cyst is when there's a puffiness on the back of the knee. That might take some time. It may never even go away, but it usually will get better as the months, more like a year or two, go by, because it's changed the way your knee is shaped a little bit. It's more of a permanent change. I say, I use the air quotes because I think there's a chance for it to change. I think our body's plastic, but it's going to be on the longer end, on the months to years time frame instead of the weeks to months time frame. So keep going, and it should improve. And if you're still having pain, I would say you're not ready for phase 3 yet, because in phase 3, it's been 2 weeks since you've had pain. It tends to be a lot better at that point. But if it's less than 2 weeks if you have pain, you're probably in phase 2, possibly even phase 1. Stick with the treatments in the current phase that you're in so that you're working on the right things. If you work on things from other phases, you're not going to make the progress that you need to make. For those of you guys who don't know what I'm talking about here, I have phases in my programs. They're designed to move you along progressively. They're very successful. And that's what we're building with the back pain recovery program right now as well. All right, good question, Marine. Lori Wilson says, thanks for addressing this topic. I found your channel this past winter and the glute exercises helped me tremendously. It took over 3 months to resolve. Thanks so much, Dr. David. You're welcome, Lori. I'm glad that you're feeling better. This is fantastic. All right, let's go to the next question here. We have Jesus in me lives. That's what that says. How do you know you are too far gone? And the follow-up question is, I was in a bad car accident. Now you are saying everything opposite of what I was told. That happens all the time. Excuse me. Now both my legs are numb, but I can still walk. Just in so much pain all the time. Oh, I'm so sorry to hear this. With the car accident, especially if it was a bad car accident, that's a different situation than what I'm best at seeing, because I don't know what kind of trauma you went through in your body, like what kinds of damage you sustained in your body. But trauma from a car accident, physical trauma from a car accident, may not always improve 100%. I don't know. It depends on what your situation is. So it's hard to tell you with certainty that it's going to improve, or that you're too far gone, or that you have 100% opportunity to improve. My best advice, though, is move forward. Figure out if you have muscle imbalances. If you haven't picked anything up from what I'm saying here, at least pick up that muscle imbalances are very common. They happen in a lot of people. Weak abs, weak glutes, weak foot muscles, toe muscles. Fix those, and you might find that you start to improve. You might start to get some feeling back in your legs if you get your abs stronger. You're taking pressure off your spine. Start there, and even if you have some permanent damage, you're going to at least move forward and see how much potential you have to improve. So just get going. Don't wait for people to start telling you to do otherwise, because I mean, unless it hurts you to do certain ab exercises, glute exercises, and foot exercises, I would proceed. If it doesn't hurt, proceed. If it hurts, then stop. You need to talk to a professional, make sure you're on the right track. See somebody in person. Jonah is in Kansas City. Fantastic. Hey, Jonah Garrett. We have Catriona Beaton in Scotland. Awesome. Norman, hashtag Jesus, when you're no longer breathing, he's trying to help out. Jesus lives in me. Jesus in me lives. And we have another comment from Jesus in me lives that says, this is new, the right side, but left leg was numb for over 1.5 years. And you know, one of the common problems that I see that causes leg numbness is when you have that pelvic shift that I mentioned that causes sciatica. It's when this pelvis shifts over. Because especially if you had an MRI and they said everything was fine in your back, that happens sometimes, but you still have a problem down here. It could be that this bone shifted a certain way and it's pinching the sciatic nerve. There's also nerves on the front that could get pinched from that same thing, and that could cause some numbness. And it could very well be something from your spine. Maybe there was something they found in the MRI, and that's the source. In that situation, you kind of have a lot of problems you got to start fixing, and they might all seem unrelated, because that's how most healthcare professionals will make it seem. They'll say, well, you have a herniated disc at L2, L3, and you have a bone spur at L4, L5, and you have a little bit of a spondylolisthesis happening here, and you have a disc issue at this problem at this level, and they'll start to rattle off, and it can get, you know, overwhelming. But what you need to rest in is that muscle imbalances are the common denominator here. And if you fix the ab strength, you're going to align your pelvis. You're going to take the pressure off the spine. And if you get stronger in your glutes, you're going to move better. You're going to have better strength moving into other things. And even if you have permanent issues, you're still going to be in better shape. So you can't lose. Work on the muscle imbalances. All right, we got Helen next. Helen DeBruin said, oh, I love your profile picture from Facebook there. It looks like a different angle of Rosie the Riveter. That's cool. Helen says, hi, is it possible or common to develop a sciatica problem after exercising the glutes, possibly overdone, to help both knees to have osteoarthritis, especially worse in the left knee versus the right glute and thigh, resulting in 2 knee osteoarthritis pain, 2 Baker cysts, and 1 sciatica leg. Thanks, Helen in Australia. Fantastic. I'm glad that you're chiming in here from Australia. Gosh, what time is it for you over there? It's got to be late. Anyways, thanks for joining. Yeah, it is possible to develop, excuse me, a sciatica problem if you overdo it. And the reason why is usually because the abs haven't been paid attention to enough. That's the issue here. Remember, I told you that the abs and the glutes need to work together, and actually put abs ahead of the glutes on purpose. You have to have good abdominal strength to give stability to your pelvis. Those pelvis bones need to be solid for your glutes to work from, because they attach to the pelvis bones. And if your glutes are getting real strong, they'll yank your pelvis bones out of alignment if you don't have good abdominal strength, and that can start to contribute to some sciatica problems. I consistently tell people it's both, not just glutes. Glutes are definitely important, especially for like a knee arthritis problem, but you can't ignore the abs. It sounds like you probably need to focus on the abs a bit more and make sure that you're moving forward and gaining stability there. And I'm willing to bet that you're probably going to see some improvement in the sciatica problem and knee arthritis problem if you get better ab strength. Hope that helps there, Helen. Thanks for joining us from Australia. All right, we got Jonah Garrett. Got a comment, a couple comments here. Jonah says, this might be the last comment, guys. He says, I hurt my knee, then a week later throughout my back bowling. Now terrible sciatica with torn left meniscus. Trying to fix it both. Posterior knee pain on the left side affecting my sleep. Help! Sciatica pain bilaterally for your information. So sorry to hear this, Jonah. It sounds like you need to probably work on the abs, the glutes, like what I was talking about. If you're doing any sort of stretching, I would avoid that right now. That could aggravate the pain in sciatica at a base level that affects people's sleep whenever you're stretching a lot. So be careful if you're doing any stretching. A sneaky way that stretching happens is if you are walking a lot because that's your lifestyle, like you have to, or you just choose to, whatever it is. Every time you walk, whenever you take a step forward, I'll do it with the skeleton here, you're putting a little bit of a stretch on the sciatic nerve. Think about it. Whenever you move this leg forward like that and you reach out to land your heel on the ground to progress, that adds tension to the sciatic nerve on the back. Bowling is going to do that too. That might have been how you got yourself bowling, how you hurt yourself bowling. It could be a very forceful activity depending on how competitive you are with bowling, how into it you are. So my guess is you probably have muscle imbalances here, and maybe you overdid it bowling. Maybe there's other activities that are contributing to this as well. Like if depending on how you're walking, if you're taking extra long steps, shorten your steps. You got to work on the muscle imbalances. The torn meniscus is a sign that you probably have weakness in your glutes, over dominance in your quads, and possibly hip flexors as well. I need you to start working on those muscle imbalances, Jonah. Right here, work on these muscles. Stop doing back exercises. In your case, stop doing quad exercises if you're doing them, because they're going to contribute to increased pressure in the meniscus. All right, let me sneak in one more here before they pull me out of the room. Cindy Milan says these exercises need to be done without including the hip flexors or thigh muscles. Is this possible? Absolutely. So I love that I'm getting here. Cindy, doing ab exercises. Don't pin your feet down on anything. That's a good point that I haven't talked about. I think the picture that people have of ab exercises is sit-ups, and you pin your feet under like a, something that holds your feet in place. If you're doing that, then absolutely you will activate your thigh muscles and your hip flexors. That's not the way that I tell people to do abs. I've got videos all over YouTube on how to work out your abs, but the way that I have people do it is you have to not have your feet pinned down under anything, and you have to begin to sit up, pressing your back down and activating your lower abs and reaching your hands towards your feet. And you may not do it the first time. It may take you weeks to get to that point where you can actually do a full-on sit-up. But when you can sit up, keeping your feet down on the ground without something holding them down, now you're working ab strength and you're not working your hip flexors or thigh muscles doing that. So there's a certain way to do this. All right, guys, I got to get going here. It was a pleasure. Thank you so much for joining me here. We're going to be doing some more exercise-themed videos coming up on the live streams. I'll have my treatment table out here soon. I think we might leave the flip chart. We'll come back to it some other time. But just those of you guys that are here as regulars, I wanted to let you know that we're changing the format. We're always experimenting and playing with things here. So very lovely to see you guys all here, see your comments and hear your questions. I will see you guys next week.